Hello everyone. Today we are going to learn about patella. Patella is also known as small plate or kneecap. In Ayurveda, patella is known as Janvasthi or Janu Kapalika. Janu here means knee joint and Kapalika came from the word Kapal which means flat bone. Patella is a triangular bone. It has two surfaces, the rough or the non-articular one which is the anterior surface and the smooth and the articular one which is the posterior surface. Please note that the entire posterior surface is not articular, only the upper 3/4 part is articular. Now let's talk about the borders. It has three borders, namely superior, medial and lateral. The tapering end is known as the apex of the patella. Now let's talk about the side determination. The vertically ridged or rough surface is put anteriorly, the articular or smooth surface is put posteriorly, and the apex faces downwards. Now let us determine that this patella belongs to which side. There is an interesting method to determine that. First, place the apex facing away from you on a flat surface. The side on which the base of the patella rests is the side to which it belongs. For example, this patella right here is resting on the right side. So, this is the patella of the right leg. Now, let's talk about the location of the patella. It is the largest sesamoid bone and is developed inside the tendon of the quadriceps femoris muscle. It is situated 1 cm above the knee joint. Anatomical position and features are already covered. Now let's talk about the posterior surface of the patella. The posterior surface is divided into two parts by a vertical line, namely small medial area and large lateral area. The medial area again is divided by a vertical ridge into a medial strip which articulates to the femur during full flexion. Now, the rest of the articular area is divided into three parts by two transverse lines. These parts are namely upper facets, middle facets, and lower facets. The upper facets articulates to the femur during midflexion. The middle facet articulate during slight flexion, and the lower facet articulate during extension. Now let's talk about the attachments. The superior border give insertion to the rectus femoris on the anterior side and vastus medius vastus intermedius on the posterior side. On lateral border, the vastus lateralis is inserted in the upper 1/3 or half part, and the vastus medialis is inserted in the medial border in its upper 2/3. Now let's talk about the clinical anatomy. The patella has a natural tendency to dislocate. This can be prevented by three factors. The lateral edge of the patellar articular surface on the femur is deeper than the medial edge. This is known as the bony factor. The insertion of the vastus medialis is deeper than the insertion of vastus lateralis. This is known as the muscular factor. And the extensions of the vastus medialis and lateralis muscle, which are known as reticula, give strength to the capsule. This is known as the fascial factor. The patella may get fractured. These are the images of pre and post operative patellar fracture and bursitis, which refers to the inflammation of the bursa. That's all about patella. Thank you.